Hello again, this is Dr. Carmen Román. I am a clinical psychologist specialized in trauma, anxiety, and depression. And we are going today to talk about the second part of this masterclass where we are comparing stress, anxiety, and panic attacks. Just a little reminder, the stress can be normal stress if you have a traumatic event and the next 3 days is expected that you are not able to sleep, you are not able to rest, and you have memories, recurring and intrusive memories of the event. After 3 days, if the stress continues from day 3 to day 30, we will call it acute stress. Still normal. Yeah, you may be working, your mind may be working by itself, or you probably have some meds to help you, or you are doing exercise or meditation or something to help you. So still is in the normal course of stress. After day 30th, and also, of course, in the first month, if any time you need help, professional help, it's important that you reach out. After day 30th, we call it stress post-traumatic disorder. And now it requires for you to seek consultation with a psychotherapist, with a psychiatrist, with your primary doctor, and set up a plan on place to work. The stress post-traumatic disorder that is not addressed, it can get actually worse. So it's important that you pay attention to that. Today, we are going to talk about the causes, how it affects your life, the treatment options, and the coping skills that you need to address this situation. Okay, let's start with the stress or the post-traumatic stress disorder. Stress happens after an accident, an assault, severe injury, earthquake, severe sickness that you may experience. And it can be also sexual abuse, for example. It can be also because you witness somebody else's traumatic event, or you learn from somebody else's traumatic event and is somebody dear to you, or you witness in the street and it was too traumatic to witness. It didn't happen to you, but you have all the symptoms. You cannot get it out of your mind. You cannot forget. It doesn't happen as often if you are watching TV and something is traumatic on the TV, unless this is the most percentage of the TV that you watch. I truly believe you normally watch horror movies or assassinations or some kind of crime, your body will react as if. So no need to get pre-trauma. I know it may seem fun, but your body is not experiencing as fun. Just pay attention to that. Also, another event could be the near-death experience. Many people report having been dead for 30 seconds or after a car accident or after a surgery or a sickness or some kind of spiritual experience. And they have been dead, and they call it clinical death also. And they experience deep sadness, profound sadness after that, and they are afraid to fall to sleep or to experience it again. Although most of the near-death experiences are so beautiful, they experience this encounter, if you mean encounter with heaven, and they actually, the depression is because they feel like they belong there. They would like to be there. It was so beautiful. Did you ever wish to be a little more selfish? To take extra time for a nap, or to take time for just do nothing, just resting, go for a walk, or close your eyes for a moment. This, sometimes some other people call it being selfish. And yes, we want to be 10% more selfish. This is the philosophy of this book. promoting self-care, and preventing burnout. For now in Spanish. For now in Spanish. It will be in English. Please, the more you comment that you would like to have this in English, the more we pay attention to it. And if you have somebody who you love in Spanish and you think needs a little bit of help in that department, go to Amazon, you will find us there, 10% Más Egoísta, with my dear Rosestella and I, who wrote this book with a lot of love for your loved ones. Thank you. And you can go back to your class now. Anxiety can develop because of this inability of your body to cope well with the internal stress we have said. And it also, anxiety can run in the family. For example, if the parents tend to be very anxious, most likely the child, one, will inherit the anxiety, and two, it will learn the anxiety behaviors from the parents. So it will be a good chance to experience anxiety. And that anxiety can be a little deeper and a little more difficult to work. I work, for example, with immigrant families. I work with a lot of immigrant families, and the first generation, I was about to say the first 5 years or 10 years is like the entire first generation. They focus on surviving. They need to pay the rent. They need to have the food. They experience a lot of traumatic events in the way here, and they face discrimination. All of this gets internalized in the body, and they don't have time. Most of the time, they don't have time to attend to their emotions. And time to attend their emotions is a luxury. So sometimes they get in a crisis after 20 years of being here, and it's an accumulation of all of this, or their children, or both, or their children have extreme severe anxiety, and normally it's because they have now the luxury to feel. This is why I call them luxury anxiety. They have the luxury to feel, and they have the luxury to go and seek for treatment, which is a privilege. We may not want to acknowledge, but it's a privilege to get psychological treatment. Some symptoms, sadly, some symptoms can be caused by hypothyroidism or by any other medical condition, like you have some lung problems or difficulty to breathe, and that creates this difficulty to breathe, this fear of breathing, and now you get scared of keep breathing. So that anxiety comes from that. When anxiety comes from a medical condition, we mention the medical condition in the diagnosis, like, and this person has cancer with anxiety, for example. So it comes together in the diagnosis. And also, let's talk about the causes for panic attacks. The panic attacks can be due to environmental factors like too much noise, or being in a concert, or being in an open space that you feel overwhelmed, or some people that are kind of taking your attention, and your body cannot handle anymore. So you may experience a panic attack. It comes also, remember, we already talked in the first part about the symptoms, about the criteria for diagnosis, and about the difference with the other two. So some withdrawal from alcohol or drugs is another way that you may experience panic attacks. People who is brave enough to stop using drugs or alcohol, they experience severe panic attacks, but they keep going, they decide, and then it is out as they get better. Medication side effects. Sometimes you are thinking, what I did, what happened, and I am weak-minded. Panic attacks is never your fault. This is important for you to learn. It's not because you are crazy. If you were to be crazy, most likely you will not be able to tell that you are crazy, because you will be far from reality to even understand that you are crazy. So crazy people don't go around and say, I am crazy. they don't know they are crazy. So that has nothing to do with craziness. It has nothing to do with something that you did wrong. It's the way your body adjusts to the stressors of life. Can you do something about it? Yes, we are going to talk about treatment options. Definitely, you can do something about it. But not your fault, remember. Exposure to trauma triggers. If you have been in a car accident in that highway and you need to pass to that highway, or if you have been assaulted in that street, or if you have, I don't know, experienced this or that in that place, or that color or that smell, or that time of the day, or that day in the year, our mind keeps track of everything. And we sometimes don't know what is it that is triggering the panic attack. Remember, the difference between panic attacks and anxiety attacks, we also talk about it, is because panic attacks are suddenly appearing, last for 5 to 20 minutes, and then leave our body. Anxiety attacks tend to be stay more and come during the day, and different ones. Can more than one panic attack come in one day? Yes, it could, although it's not that frequent. Yeah. People actually who have a panic attack may be really worried or may be afraid of the next panic attack, which this fear is the one generating the next panic attack. And it's unfair because they cannot stop being afraid. Yeah. But when you work on your breathing exercises, when you are not experiencing the panic attack, is when you need to work. You work in your breathing exercises, in managing your body, in doing a lot of things that we are going to talk about in the treatment plan, in the treatment part of this presentation, then you can space out and eventually get rid of panic attacks. Overuse of stimulants such as caffeine or these energetic drinks or something, and sometimes sugar. This sugar rush, like a good piece of cake, may give you this panic attack. It actually may give you anxiety attack. Anxiety attack are mild, if you wish, are less intense, and you lose less control of your body. But you experience this. And having an anxiety attack, you will be afraid to have the panic attack. Let's talk about how these 3 conditions affect your life. What do you think? How the stress affects your life? Well, you may have guessed. It causes impairment of the social, occupational, or other areas of your life. The people that suffer from chronic stress or from post-traumatic stress tend to be shielded from positive emotions. What does mean this? It means that you will be more prone, or you will be more inclined to feel what is called negative emotions. Emotions are not negative or positive, but for the sake of this episode, let's call it that way. Emotions that are not nice to feel. You may be more prone to feel irritable or anger or frustrated. And because you tend to freeze your feelings, when you have a trauma, you freeze your feelings to survive. That's a natural response. Those feelings, the threshold is high. So feelings of gratitude or feelings of love, compassion, beauty, appreciation, aesthetic appreciation, for example, triumph, admiration, they don't make it to the threshold. So we have here the threshold. They don't make it. It's not that you don't feel them. They are there. It's that they don't pass your threshold to acknowledge them. So you say, why am I actually unhappy? You may experience unhappiness, but the other feelings are so strong, and you are freezing your feelings until a certain point that you didn't notice that you have those feelings. Sleep disturbances is another. So if you don't sleep, you tend to be irritable the next day. You tend to be on the edge. So it will make you a difficult person to deal with. Yeah, so you need to be aware of your symptoms. So when you start feeling like on the edge frequently or irritable or difficulty to sleep, it's time to seek psychotherapy because it may help really in a lot of areas in your life. Of course, people with uh, stress post-traumatic will experience these flashbacks and tend to dissociate. So they may not enjoy as much the social life as others. They may have very hard time going to a party, seeing people happy, um, being in a crowded environment, in a loud environment. They get sensitive. And again, it's not their fault. It's something that they need to do to conserve energy, to survive and to be. In order to explain for you how affects your life, especially the anxiety and the panic attacks and the stress post-traumatic, I am going to put you a metaphor. Imagine that we all have 100 coins of energy during the day. Everybody gets our 100 coins. And you wake up, do your life, you have 50 coins by the middle of the day, in the afternoon you have 75, and then you go to sleep and 100 coins the next day. Somebody who experiences anxiety, stress, or panic attacks or depression, they may run out of coins by midday. They may be 10 a.m. in the morning and they already spent 80 coins and they need to survive with 20 the rest of the day. They have hard time having energy to wash dishes, to move, to go shopping, to go to a shoe store and try different tennis shoes, to try different dresses. It's not that they don't want to enjoy life, it's that they don't have energy to enjoy life because their body is using that energy in keeping them alive. So anxiety and panic attacks are people who also have suicidal thoughts because their energy runs out and they get frustrated and they start in this desperation phase. I am a huge believer of nap times. Why? Because the nap time will be like cheating to the bank. Yeah. It will give you these 20, 30 extra coins that you need to survive during the rest of the day. And it will make you less cranky, more fresh, and more willing to socialize. So nap time, even 20 minutes of nap time, it will be a refreshing, good news for you during the day. Of course, we are not in a culture, at least in the United States, we are not in a culture of naps. So we may invent our own culture about that. Do what your body needs. So people, that will explain you how it affects their life. If you never experience anxiety, that will help you to understand. They have changes in their personal life, in their professional life. They don't have ability to concentrate, to memorize stuff, and they avoid certain events, situations, or people because they have fear or embarrassment. People with anxiety are worried whether or not they are being accepted. Constantly worry about how they are being seen, they are being accepted or not. They second guess themselves. So this second guessing takes a lot of energy. And let's talk about panic attacks. The panic attack can affect your life in the way that you have fear of the fear. You live with fear that you have the other panic attack or that you will be afraid of something that triggers that panic attack. Therefore, they try to avoid situations, objects, people that they think it may trigger the panic attack. And the difficult part here is when they had the panic attack, sometimes it's very difficult to pinpoint what is it, the cause. And when you don't know the cause, you may say, I had a panic attack in street 20 and 4. And every time I go there, I'm afraid I will have. Why? Because you tend to do generalizations or tend to jump logic jumps that doesn't really matter, but your mind made it. So last time I had a panic attack, I was with my tia Petrita, and every time I see my tia Petrita, I get scared. Nothing to do with the tia Petrita, but you thought that way and you are going to be anxious when you are there. Or last time I was taking a shower, or I was eating that or doing that. So remember, sometimes we don't even know what is the panic attack. It may be that your body just overpassed its limits 3 hours ago and now is in crisis. But that was 3 hours ago and you don't know what happened 3 hours ago. So that of course hinders their social life, their professional and personal lives harshly. People with stress post-traumatic disorder, with anxiety, severe anxiety, or with panic attacks tend to get better? Yes, definitely. This is why I love my profession, because I can see them, how they get better. They need to work on it. 1 session, 10 sessions is not going to do anything for you. Taking only pills by not going to therapy and not doing exercise is not going to do anything for you. You need to find the combination of treatments that work for you and keep going until you get better. And you need to learn yourself to behave differently. I know already that if I exhaust myself, if I drink all night and I have fun all night, tomorrow is going to be a very heavy day for me. Therefore, it's up to me to put myself into that kind of life. Or I know myself that if I eat the whole piece of chocolate or the whole big coffee, very dark coffee, or I know myself that if I go to that party or if I do that, I am going to pay the price the next day. Therefore, it's my responsibility to move around my choices. And some people don't want to do choices. They say anxiety doesn't get better, but they, get drunk every weekend, or they don't sleep, or they overwork or something. No, it doesn't get better. Never get better that way. So you need to do your part. Let's talk about treatments. Treatments is my favorite part because it's like there is hope here. There is always hope. Treatments. For all of them, I recommend transpersonal psychotherapy. I am going to mention more than one, don't worry. Transpersonal psychotherapy. Why? Because transpersonal psychotherapy addresses also your spiritual aspect. And what I notice is people who have a spiritual practice, any spiritual practice that you may think that is working for you. Doesn't matter what religion, what kind of spiritual practice, tend to get better because they learn some trust. And trusting is one of the underlying conditions to get better from panic attacks. Gestalt therapy. And you say, what is that? Gestalt therapy. Gestalt therapy was more famous on the 70s. In Mexico, is still very present. They removed it a little bit from the United States, mainly not because of the Gestalt therapy, but mainly because of the person who developed Gestalt therapy was a little out of place. But Gestalt therapy is if you ever experience an empty chair exercise that somebody sit in front of you, that means they make you talk to the other you in front of you, or you get guided meditation that takes you somewhere. That's Gestalt therapy. Yeah. A guided inner exercise, like emotional exercise. That's Gestalt therapy. Gestalt therapy was developed by an actor and a psychologist. So it's a lot of drama and acting and all of this. It's fun. It's really fun. And it's really useful. Trauma-focused therapy. So some of us are experts in trauma. It's like a cardiologist. Yeah? Like in the physician's comparison, a cardiologist will have some kind of specialization. Some of us are trauma experts. EMDR, which stands for eye movement desensitization, sorry, I usually don't know how to pronounce, and reprocessing. That means they will ask you to close your eyes, and while you remember the event, you don't talk about the event. While you remember the event, you move your eyes, and people swear that it works. I have listened more from clinicians than it works than from clients. Clinicians swear and love the technique. Clients don't mention that much. So it works. Maybe this is why probably so many clinicians specialize on that, and you are free to try and let me know if that works. I am always open to keep learning. I do believe in EFT therapy, emotional focusing therapy, which is tapping. Yeah. And this tapping, we know it as a tapping, needs to be done by a professional psychotherapist who also specialize in tapping. Not that tapping that your coach or your friend or your neighbor knows how to do. No, a professional tapping experience, because they work with your symptoms and they use your symptoms to create the sentences that you are going to say while you are tapping. And I experienced one professional session, my first professional session, and it was amazing. And that was 2-3 years ago. It was amazing. It got rid of a symptom that I will never even knew it exists. CBT is cognitive behavioral therapy, and that therapy will help you to create new habits. Like you are going to breathe certain times a day, you are going to journal about it, etc. Art therapy, it's not like you doing art. Oh, I am in my art therapy because I went a workshop with painting and wine drinking. That's not art therapy. Art therapy is actually with a specialist in art, in expressive creative expressions, will choose together what modality will work for you. Music, what kind of music? Painting, what kind of painting? What kind of media you use? Clay, or I love dance therapy, for example, or movement. What kind of movement will help you for your symptoms, for your particular symptoms? So to be specialized. And also sand therapy. I have a box in my office where it's a sand box, and it has sand from the ocean, like let's say 5-6 inches deep. And I have small figures, and then you put the figures and you put them under the sun, on top of the sun. All of these arrangements that are symbolic arrangements that will inform your body and your brain that something is different. I love sand therapy because it really makes changes in a profound level. All of these non-verbal therapies gave you changes in this non-verbal area. Why we need that when it's trauma or deep anxiety or panic attacks? Because what happened is, actually, as I am thinking right now, in 30 years of working with trauma with people who have panic attacks, I only have one person having a panic attack in my therapy room. And why? Because normally we are in a very relaxed environment, and even though we are talking sometimes about the trauma or whatever, it's regulated, so you don't get out of the charts. Yeah. So I didn't realize that before. So talking about the trauma doesn't necessarily bring you more trauma. It's the regulation of that talking. And the therapist needs to be ready to interrupt you when it's too much, when it's too little. It's a regulation of the conversation. Therapy is not like a normal conversation. You go to therapy to explore who you are, and the therapist will manage how the conversation will go. So it's not like talking to your friend or your family member or anything. It's a technical conversation, you must say. Yeah. So the non-verbal therapies will help you because some of the symptoms or some of the experiences have not even come to words yet. You don't even know they exist because your conscious mind and your verbal mind, it doesn't register everything that we experience. So when you work with all of these movements and music and art and all of this, it helps in much deeper levels. In some cases, medication can help. In some cases, not in all of it. And that is for the psychiatrists and the psychologists to decide. Sometimes people come and say, please, I need a pill because a pill will make me feel better. But you don't want to do the work. So remember, taking the pill is not an excuse for not doing your work. And if you don't do your work, you may take the pill and keep getting worse anyway. And you say the pill is not working. It's not working because you are not helping the pill. So not all the time it requires. But also, there are some times that the pill is actually the number one treatment that you need. So this is why you need to come with professionals, psychiatrists and psychologists, and sometimes both of them. It's important to notice that when you are taking pills, medicine, psychiatric medicine needs to be prescribed by a psychiatrist. Some people go to their primary doctor and the primary doctor with very good intentions gives you the pill, but they are not expert. A psychologist is not an expert unless there are some psychologists that work to have that kind of license to do some prescriptions. So the prescription needs to come from an expert in mental health that is qualified to prescribe medicine to you. Some teas, herbal teas, you need to go to an herbal specialist. Some teas are amazing in helping you work with stress and anxiety symptoms, relaxation techniques, or mindfulness. This is why I really love the Insight Timer app, because you have thousands of teachers, thousands of meditations, different styles, different moods, different everything that you may want to work on, most of them for free or very cheap during the year. So you can have all the resources that you need in that Insight Timer as mindfulness refers to. And the difference between Insight Timer and YouTube is that Insight Timer, you can listen during the night and it doesn't jump to the next track. It's just finished. It just turns off by itself. You can keep sleeping and the next day you say, yes, did I finish? So no, Insight Timer is not paying me to tell you that. It's just that I am really fan of this application. Life changes to reduce stress. I told you, it's changing completely your life to manage your stress. Living differently or living as you probably should have been living at the beginning. I don't know. Yeah, it's up to you to determine that. So for panic attacks, the treatment is medicines that I told you may be prescribed, and also combination with reduce of stress, mindfulness, and psychotherapy. All of it together. And it's very possible that you first start spacing out the panic attacks, and eventually they don't need to be in your life because you pay attention. Panic attacks is a way of your body of really calling your attention. So it's important that you pay attention to that. Coping skills you can use, well, your exercise, your eating habits. It's important that you manage the way you eat and you manage your sleep hygiene. What does mean? That you need to be extremely conscious about what kind of eating you do, at what time of the day, etc. And it's not that difficult to do. It just requires your attention. It requires probably from you to be cooking more, so you have less chemicals, etc. And sleeping hygiene is what we will ask to a child. Get 30 minutes earlier to take a shower. If you need to take a shower, put your pajama, and then for those of us who use makeup to remove the makeup, wash our face, do less light, no electronics, turn off all your apps, not inside timer. I usually leave my inside timer on during the night, or I mean accessible during the night. Because in the phone you can block all the other applications. So you don't have the temptation to go to social media. No social media during the night. Sorry. And why no social media? Because social media will make you more anxious. So there is no need to bring anxiety to your life while you are trying to rest. Breathing techniques for all of them, especially for panic attacks, challenging your negative thinking. You say, life is really bad. And you say, well, sometimes, maybe not. Yeah, sometimes it's beautiful. And every kind of mindfulness exercise. And if you can adopt one of these Tai Chi or Qigong or any kind of exercise, yoga is always wonderful to ease your mind. That will be amazing. Well, we have been talking about during this masterclass of this comparison. I told you about what is the coping skills, what are the treatments. I told you how it affects your life, the causes of stress, anxiety, of panic attacks, and we talk about the symptoms in this masterclass. We talk about the criteria for diagnosis and what are the characteristics of each one of them. I hope you really enjoy this masterclass, and I hope to see you the next one. Always feel free to comment, to send me questions or something. Just be patient that I will respond as I can. Thank you. This is Carmen Román, and it was a pleasure to be here with you. Bye for now.